Captain Trevor Jackson? Ma'am. Army?
Ranger, 1st Battalion, 75th Regiment.
Cool. Follow my pen line.
You, sir?
Navy. Reservist now. You're a long way from Georgia. What brings you in today?
Bender. It was my fault. I got lightheaded. Thought I was gonna pass out.
Well, you've been drinking, soldier.
No, sir.
It's blood work. You two in time for business, pleasure?
Visiting my family, Lincoln Park.
Yeah, I gotta get back to duty. Mother-in-law's cooking. He's packing on the pounds.
Kids?
Not yet.
One day, baby, one day. I don't want her to have to raise kids alone while I'm still being deployed.
Captain Jackson, are you diabetic?
Not.
I'm afraid these numbers indicate differently. Your blood sugar's at 350.
No, there's no way I have diabetes.
Baby, listen to the doctor.
If I have diabetes, they won't deploy me. And that's it, I'm done. And I can't be a soldier anymore. You understand?
Well, it's true you don't have the classic risk factors. Obesity, family history, and your white blood count is elevated, so it's possible there's some underlying infection driving your blood glucose up.
Okay.
We'll run some more tests, see if that's the case.
Please.
All right. We'll be right back.
It's gonna be okay, honey.
Dr. Charles, you have a minute?
Sit down. Don't mind if I eat? I've made breakfast.
Please. It's my patient, Captain Jackson. He's a physically fit, active service Army Ranger, but his blood sugars indicate he has diabetes.
You run labs, do a CT?
His pancreas is healthy. There are no sign of tumors. His labs came back clear for infection and autoimmune disease. Can't find a reason for his diabetes, but I did find this. He fractured 2 thoracic vertebrae.
Ouch.
Exactly, so why hasn't he said anything?
Why do you think he hasn't said anything?
Overseas, I saw a number of soldiers who were away from home a lot. They were depressed.
Depressed patients tend to mask or hide pain.
Right. But the thing is, diabetes is a red flag for the military. You test positive, you don't go back to combat.
But if you're depressed about overseas deployment.
You think he might be happy to have diabetes. He's home for good. But that's not the case. Jackson's extremely upset at the possibility of not going back to active service. Something's going on with him.
Let's go say hello to Captain Jackson.
Thank you, sir. This is Dr. Charles. He's a senior attending physician here. I've asked him to consult just to make sure we're covering all our bases.
Yes, sir.
Please, as you were. You're Mrs. Jackson?
Yes.
It's nice to meet you. I just wanted to make sure that I have your history straight. So, you've seen combat before?
Yes, sir.
And this was your first tour?
7th.
7th. And
What was in the test results?
You have a couple fractured vertebrae that will heal on their own, but all your other tests failed to give us an answer. We can't find a clinical reason for your high sugars.
Clinical? What does that mean?
a physical cause.
I'm sorry, what kind of doctor are you?
He's a psychiatrist.
A shrink. Okay. I don't need a shrink. I'm not crazy.
Nobody's saying that you are.
Honey, they're just trying to help you.
How is a shrink gonna help me?
As I said, we're covering all our bases.
You think I'm faking this?
No, you can't fake blood sugars.
So what are you saying? Huh? You think I did something to myself? You think I'm a coward?
Not for a second is anybody saying you. Whoa, Mr. Jackson.
Captain, I'm out of here.
Hey, Mr.
Whoa, Captain. Captain!
Nurse, please.
Little help!
How's he doing?
Okay.
Don't think it'd be a very good idea for me to go back in there.
No.
Wow, 7 tours. That must be tough.
I knew what I was signing up for. I'm proud of my husband,
Of course. I know you must miss him and worry about him.
like every soldier's wife.
And I know the illness is a blow, but at least, you have him home and he's close, right? Mrs. Jackson?
I'm sorry, I don't want these to get cold.
I won't keep you long. In reviewing your husband's symptoms, I'm pretty sure I know what's causing his diabetes. And I think you do too.
What? What are you talking about?
You don't You don't lie a whole lot, do you? I mean, you're certainly not very good at it. To your great credit. To lie well, you have to loosen up, you know, make eye contact, stuff like that.
I don't understand what you're saying. I mean, lie about what?
Somebody's got to go there and tell your husband the truth. I could do it. Let me hold those for you. Afraid I've got some bad news.
Oh, please, I am having a terrible day.
About to get a little bit worse. We have a case of domestic abuse on our hands.
You couldn't. Are you out of your mind?
That woman has been poisoning her husband with prednisone.
Why would you do something like that?
I read on the internet that if I gave him some prednisone, it would look like diabetes. I just wanted him home, safe. It's been 10 years of worry, of nightmares. You can understand why I did it, can't you?
Well, whether I understand or not, it doesn't matter.
There's a doctor here. Her husband was a ranger, and she lost him. He's dead. Isn't it better to be sick than dead?
Why did you let it go so far? Why didn't you talk to someone?
What good would talking do? I wanted him home. Talking wouldn't bring him home.
Mrs. Jackson, I'm sorry. What you did is a crime, and I have to report it.
Am I going to go to jail?
I don't know.
We'll taper off the prednisone. Your system will purge it over the next few days. The side effects will dissipate and your blood sugars will return to normal.
Where are they taking her?
She's turning herself into the police.
Lauren!
Captain. Easy.
We'll get through this. Together.